Hey all, today we are going to discuss about very important recent advances, paper 4 for university exams questions. Remember 10 points for every questions. Time management is very important. 1.25x speed, watch this video. Disclaimer is given in the description. Let's move on to the video without wasting the time. So, what are blood substitutes? To mimic the blood and its functions. Why it is needed? Conventional blood has short supply, rare blood group, immunogenic, incompatible, and risk of transmission of infection like HIV, HPCG, hepatitis C virus. It has shorter TF. That's why we use blood substitutes. So blood substitutes, no risk of infection, universally compatible, easily and readily available, no cross matching, cost effective, long TF. And what are they? They are volume expanders, crystalloids and colloids, oxygen carriers. So what are oxygen carriers? Heme assist perfluorocarbon based auto carriers, hemopure, polyheme, oxyglobin, and dendrimers. Others, platelet based carriers, placental umbilical cord blood. Crystalloids are NS, RL, isolate M, isolate P. Colloids are hydroxyethyl starch, dextran, gelatin, albumin. Hydroxyethyl starch is safest to be used. Dextran is highly immunogenic. Albumin is purified protein. It is available in two forms, 5% and 20% albumin. Perfluorocarbon based oxygen carrier, oxysite, perfotron, and PHER2, 50 times more autosoluble, increases the delivery of oxygen, inexpensive. Side effect, flu like thrombocytopenia. So what are all the general complications of this blood substitutes? Nephrotoxic, allergic reaction, immunogenic, and volume overload. So that is one question they will ask you about suture alternatives. So instead of skin sutures, you can go as adhesive skin strips, tissue glue, staples, lap wound closure. So what are adhesive skin strips? Tegaderm and Bioderm. These are transparent dressings, so no tension, no moisture. Wound inspected periodically for signs of infection as it is transparent. Cosmetically more better. Tissue glue is a cyanoacrylate monomer. It need not to be dry, so it has no tension. On application, this monomer is converted to a polymer. It will polymerizes fibrinogen into insoluble fibrin, promote the cross-linking of the tissues. Thereby, it will promote wound healing more better, decrease risk of infection, cosmetically more better. No need to remove the sutures. So lap wound closure for 3 to 12 mm defects, we can go with adhesive strips, staples, straight or curved needles. What is meant by ontogenesis? Just think of Indian robo. Ontogenesis differ from oncogenesis. Study about the development of organism from the point of fertilization to adulthood till death. It is nothing but ontogenesis. Physical and psychosocial. Physical growth and differentiation of cells. Psychosocial, cognition, emotional and social development. Growth and differentiation of cell migration and cell division. Ontogeny, a single cell to multicellular organism. So how it is formed? How does cell growth is influenced by the external factors, for example, neural basis, cognition, emotional, psychosocial, genetic factor, environmental factor, hereditary factor. Phylogeny is development of species. Ontogeny from single cell to multicellular organisms. For example, a fertilized egg, how it is developed into an adult. So various phases in adult, embryonic and post-embryonic. In higher animals, prenatal and postnatal. So what is the significance of ontogenesis? With this we can able to understand development, genetics, healthcare. In development, social, psychosocial and biological. Genetics, epigenetics and genetic influences. Healthcare, evolution, animal husbandry, innovation, research in medicine. So sometimes they may ask you single incision laparoscopic surgery called as SALS. So it is a minimally invasive surgical technique. It is cosmetically better, reducing the pain, faster recovery, reducing the risk of complications. We perform cholecystectomy, appendectomy, hernia repair, hysterectomy and even ovarian cystectomy using a single incision, a dedicated specialized instruments. It's a surgical procedure through a single incision, closure with sutures, but not suitable for all the patients and technically demanding, potential for longer operative time. So we must know about a very important topic called as port placement, a critical aspect of laparoscopic surgery. So what are all the key principles, which is nothing but triangle of safety. It's an optimal triangulation for instrument manipulation, visualization. Common port placement configuration, classic triangular configuration, reverse triangular configuration, linear and single port laparoscopy. When placing ports in laparoscopic surgery, the port placement is 15 to 20 centimeter away from the center port. The target organ should be 15 to 20 centimeter. The one point we have to remember here is a target organ azimuth angle is between the laparoscopy telescope and the working instrument, which is 30 degree. Manipulation angle is between two working instruments, which is 60 degree. Elevation angle is between the horizontal bed and the working instrument, which is 60 degree. And these three angles are very important.